Guys, I had a great speech going. I'm so sorry. What I was saying was that I'm Roya, I'm mute, but I'm one of the P2I4s in our program. I'm very excited to talk to you about the UCLA VA PM&R program. And so I'll go ahead and get started. So my plan today is to tell you all about us. I want to give you my perspective as a resident that's been part of the program now for almost 3 years, what skills that we're confident in, and kind of what's the trajectory after we graduate. And then everyone always asks on interviews, what would you change about the program? So we're going to be really honest and give you our perspective, and then where we tend to live and what are the cool things about our program. There's many perks. I'm excited to talk to you about that. And then I'll share some pictures at the end if there's time. And obviously all these pictures are pre-COVID if we're not wearing masks. So in general, we're a very diverse program. We're actually a pretty big residency program. We have between 8 to 9 spots. So there's a bunch of us from different backgrounds and interests, and we love hanging out, and we're a big family. So I'm very excited to kind of give you a taste. A lot of us are from California, but not everyone is. So some people are out of state. And then there's some people in our program that are married and have kids. Some people are not married. Some people are almost getting married. We've got families with kids, families with dogs, with cats. You know, it comes in all shapes and sizes. I work out personally every day. And that's a cool thing about our program is you have time to work out and take good care of yourself. Some people work out never. Some people on the weekends, they work out like crazy. And in general, our program is very blessed to have very approachable faculty. In this picture, I'm in the left corner with Dr. Pham, who's also the pain program director for our fellowship. And she was like, Roya, come here, let's take a picture together. So we just kind of have fun. Our attendings are very smart. They're very kind with their treatment of house staff and with patients. So it's a very cordial and loving environment. And rotations with us are very fun. I've had a really, really good time getting to rotate at all the different sites. The top right corner is CHLA. And I'm going to kind of just break down some of our rotations that we do. So one of them is our ARU at the West LA VA. This is our bread and butter PM&R exposure for acute inpatient rehab. It's a center of excellence for stroke. We get a lot of post-op ortho neuro care. We do get the occasional case reports and zebras, but then there's also a lot of bread and butter to help you get comfortable. We do take some home call during this rotation. Again, very manageable. It's spaced out. Everything in this program is very based on preserving resident wellness. So it's nothing too crazy. And I'll summarize the call at the very end. Then we do our outpatient clinic at the West LA VA as well. This is where we get our EMG nerve conduction study exposure. We do a lot of procedures at West LA. So we've done a lot of Botox for migraine. Ultrasound, if you want to experience an ultrasound walking out of residency, I've done so many knee, hip, shoulder injections. I've lost count. I've learned them doing different approaches. So if you want to be like completely confident walking out of residency, it's definitely doable at our program. And then we obviously do all the neuroaxial injections with the pain folks. Those are your RFAs, your epidurals, and more. We do those more as senior residents so that you can get, the experience to build up to those procedures. And then obviously we do lots of trigger points. We do nerve blocks, neurolysis. We do backlift and pump refills, all the good bread and butter PM&R stuff. And for our consult rotation, so our consult is also at the West LA VA. This is pretty busy. We do cardiopulm and we do general consults, and we do take a week of call in this rotation as well. And then we do one other rotation through the VA, the Greater Los Angeles VA. And this is Sepulveda. This is a really fun clinic to rotate out. It's all outpatient. You get great EMG, NCS exposure again, kind of a different population than the West LA VA. So you get a variety of patients. And again, lots of injections, lots of ultrasound. So if you're interested in ultrasound, you'll be very confident coming out of our program. And your MSK knowledge in general will be very, very strong. For our UCLA rotation, so we rotate with UCLA spine. And so that exposure is, you learn how to do EMG nerve conduction studies with them as well. And then they do a high volume of axial injections. So they're doing bunches of epidurals, RFAs, spinal cord stimulators. As a resident, you'll probably be mainly working on doing your medial branch blocks and your epidurals. And then again, just want to point out that we're lucky and blessed that, you know, our health system got rated in the top 5. I believe we're number 4 this year in US News World Report. We also rotate at California Rehab. So this is a really cool ARU that's actually run by Select Medical. It's the largest inpatient ARU on the West Coast. It's a little bit of hybrid between academics and private, and it's very fast paced. We've got medically complex patients. So I think coming out of our program, you'll be able to handle any type of ARU acuity, because the patients here can be very sick and they can also be very complicated. We do take call during this rotation as well, but luckily you get unlimited coffee. They just got an espresso machine. It is stocked every day, full of pods, so you'll be plenty caffeinated to handle your call. It's also next to the Century City Mall, which is this incredible, it's one of the best malls, outdoor malls in the US. So if you want to like take a break, go have lunch, it's totally open to you. And there's abundant of famous patients. I've taken care of many, many famous people, but we'll maintain the anonymity. I'll keep it anonymous for HIPAA. Our other really fun rotation is Rancho Los Amigos. That's actually that very famous hospital that the Rancho TBI scale is named after. This is where we do our traumatic brain injury, our neuro rehab. You get a lot of polytrauma because this is a county hospital. So you get all the encatchment for LAUSC, which is one of the biggest county hospital systems, along with UCLA Harbor. You also might know Rancho for Jacqueline Perry. She's the master of gait, and she has over 200 publications. So the history of our program is very rich, especially with our strong affiliation with Rancho. We also get to do a bunch of neurolysis injections. I'm pretty sure I did more Botox injections than some people will do in our lifetime with Dr. Ayub. He hands down does the most injections. And so it's a really, really great learning experience. They've got good food and it's free. And they just redid the rehab facility. It's beautiful. And you get to treat the county population, which is awesome. I love working in that environment. Another rotation that we get to rotate with is CHLA. This is the top 5 pediatric hospital. And again, you get a very comprehensive exposure to TBI, SCI, ortho rehab, and it's in the pediatric population. And actually the main rehab director, Dr. Kevin Craig, he is actually world renowned. He gives guest lectures across the world for how to run pediatric rehab units. I think that like my peds rotation, it was funny. I wasn't even considering peds, but it was such a fun rotation that I was like, wow, this is something I would totally consider if I wasn't already applying to fellowship. And then sometimes people ask about our adaptive sports. So at Long Beach VA, we also rotate with UCI. We do our spinal cord injury rotation. And this is a pretty amazing experience because it's a dedicated spinal cord injury center. So you get to see this very comprehensive health system. And the cool thing is that they emphasize teaching. So the didactics are very robust. And then along with that, the adaptive sports. So I got to try all sorts of wheelchairs, adaptive equipment, adaptive sports. And honestly, before I did this rotation, my SCI scores were really low on the standardized exam. I did this rotation and then it just like completely changed. So you come out of this rotation ready to handle any spinal cord injury question. And in the corner there, that's our chief resident, Calvin Ho, doing a simulator where he gets to practice driving because they do adaptive driving rehab. So again, very cool rotation, very fun. I even got to try adaptive archery during my rotation. And I actually got to be first assist on a tendon transfer repair. They basically carved out a time for me to go work with the plastic surgeon that does the tendon transfers. And again, like I got to learn the anatomy really well. I really appreciate the surgery and it just helped me, better treat our spinal cord injury patients. And then again, Calvin Ho is using adaptive hand cycling here, which is a really fun exposure to kind of bond with patients. So hand cycling and then wheelchair basketball, which is very rough on the traps if you've never done it before, but very fun and it's great to like crash into people. So basically for us, our call is, we've got certain rotations where we take call. So our VA ARU, our VA consults, our PEDS, and then our Cal Rehab rotation, really it ends out to average out to be 16 weeks of call, 16 weekends and 16 weeks roughly, but about 16 weekends of call over 3 years. So I do about 5 weekends of call a year. So it's not bad at all. Very manageable, plenty of time to pursue other things if you're interested in other things within rehab. So when we leave our program, I think that we're most confident in handling medically complex patients. We can handle TBI, SCI. We are very confident in our soft tissue and joint injections, and we're very confident with ultrasound. And then if you want to be good at EMGs and nerve conduction studies, that's definitely doable at our program. We get a lot of exposure in a lot of cases. And then the cool thing is we work, and what makes our program truly unique is that we work in every medical system. So we work in the county, we work in academic, we work in a VA, we get a little touch of private practice. So you can kind of see what billing and all that stuff is like, if that's something you think you're going to be doing. And you work with all the EMRs, the medical record system. So you kind of get an idea of what you're getting yourself into when you're looking for your job. And so I think that's been amazing. I really liked working with the county population. So hopefully one day, maybe I'll get to work, in a county setting. And I wouldn't know that I hadn't done a residency program. So what do we do after residency? Well, we do feed to a lot of pain fellowships. We are a little bit heavier on that side. We had one fellow match in our pain program, one at Loma Linda. We have actually non-accredited spine and sports program at UCLA. So usually one of our residents will match there. We do a lot of sports fellowship. So we've had people match at sports at University of Chicago, where his hometown was. We actually have an affiliation with Harbor UCLA Sports Medicine. So we just had one of our graduates just started fellowship at Harbor UCLA. We've got some folks that went into neuromuscular at UC Davis, and then some people go straight. So you definitely don't need to do fellowship. We've gotten people hired at Loma Linda. People have stayed at through the VA system. One of our recent graduates just got hired at UCLA Spine. So there's academic, there's private, there's VA, and there's just the whole lot of opportunity. And one of the reasons why is because our alumni network is so extensive. The perks of our program is it's been around for a long time, and we have big class sizes. So literally you can go to our program director and ask about any program, at least in Southern California, and she has a connection. And so we do a lot of relations with our alumni. We gather, we socialize with them. We have mixers. We gather once a year for AA, PM&R. Obviously with COVID, there's kind of a wrench, but once things start to pick up again, we really interact with our alumni regularly, which is great because you can email them, you can ask them for questions, and they can help you get that first job or help you get your foot in the door for fellowship. So yeah, and then again, like our program director is probably one of the strongest things about our program, Dr. Aragaki. And hopefully if you guys are interested, we're gonna have a roundtable kind of meet and greet where you'll get to meet our program director. She's not here today, but she is the best. Every resident in our program swears by her. She totally goes to bat for you. She will put in a good word. And when I interviewed for pain fellowship, I had multiple people from various programs say hi to Dixie for me. And I'm like, oh, Dr. Aragaki, because she is so well known and well liked by everybody in the community. She's leadership at AAP, and she teaches at the UCLA David Geffen School of Medicine. So she's fantastic in every way. And then I'll start to sum it up with what we would change. There's not many things I would change about our program, honestly. For our VA rotations, they use CPRS. I think that's universal for any PM&R program through the VA. So that's kind of a clunky EMR. We do drive a lot to our rotations, but honestly, the way that the rotations are set up, we're always the reverse direction of traffic. And we often carpool, and our hours are very reasonable. So you're usually home by 5 most days. A bad day, you're home at 6 maybe. So it's totally doable. And then research can be a little slow. We're not the heaviest research program, but honestly, we have so much flexibility within our schedule that you can totally be productive. You can do a lot through UCLA. So there's just a lot of open doors if you go out and seek to open them. Again, we do live in Los Angeles, so our weather is pretty amazing. We're in the 70s. Doesn't rain too often, so the beach is available most weekends. And again, if you want to take a trip to Big Bear, it's an hour away if you want to go snowboarding, skiing. So yeah, there's so many different trips within Southern California. Again, we do a Big Bear trip, pending COVID, which is really awesome. We do it as a class, and then obviously we have actually a beach trip as well for the surfers. And most of us live in West LA because it's reverse direction of traffic, but we can live in various cities around Beverly Hills, Marina Del Rey. Rent is high, but we get a housing stipend. And also UCLA has subsidized housing that's a lot cheaper as well. So there's multiple options to make having a family doable if you have one or planning on starting one. And again, perks of our program, we get to teach the medical students. We have great educational dinners, didactics. We're tied to many fellowship programs. So we have our own, one of the few PM&R based ACGME pain fellowships is through our program. And we get to rotate with them. So you'll build great rapport with the faculty. We also have strong affiliation with one of the few ACGME programs that take PM&R grads for sports. So again, Harbor UCLA. And then for our sports exposure, we do sideline coverage, Friday night football games, super fun. It's honestly one of the best experiences I've had in my career in medicine is working the sidelines. It's just been so fun. And then we also work with the Long Beach UCI SCI program as well. So you'll meet the fellowship director on that rotation. Again, research, you get 1 month of elective that you can do more research, but you can always pursue it on your free time. And then also the program is super pro. You going to AAPM&R as a senior resident. And then, if you have a project, I went as a junior and just submitted a poster, and it was a really fun, great experience. And again, we got plenty of time for teaching and volunteering. We work with the UCLA medical students. We do mobile clinic with them, which is a free clinic. I taught problem-based learning to the medical students. So I would wake up before my ARU rotation and go teach the UCLA medical students problem-based learning, super fun. And then everybody in our program gets to teach physical exams. Obviously with COVID, it'll probably be virtual now. And then you can do MSK ultrasound as well. We have an ultrasound interest group at UCLA. One of our core faculty, Dr. Pham, is actually a block chair. So she's very involved with teaching. So many ways to get plugged in. And then we also get outside rotators at all of our various sites. Right now, pending with COVID, unfortunately, we don't have outside rotators, but I imagine that she'll open up. And then again, if you like sports, UCLA is where it's at. We've got incredible facilities and you can play intramural sports. I've won, I think, about 4 t-shirts in intramurals since I've been a PM&R resident. So it's been really fun. And then we've got great healthcare. Our 2 chief residents had kids through UCLA and they had great experience. You can ask them about it. The healthcare coverage is incredible. It's one of the best health systems. So you get really good specialists. Hopefully you'll never need them, but if you need them, they're available. And that you just mentioned your house staff and they got you covered. It's great. And again, our didactics are awesome. We get a lot of exposure to board certified, EMG and CS. The person who teaches the UCLA anatomy course teaches us. So really great curriculum overall. So yeah, I don't know how I'm doing on time. Hopefully I'm not running too far.
Got about a minute and a half left.
Okay. So just real quick, here's some pictures. Woo! We have so much fun. And this could be you. And feel free to email us, UCLA Rehab at Gmail. We do have an Instagram. And then if you want to email me personally, that's my email. And then if you guys, I guess, can do like 30 seconds of questions, the chief residents are available too if you want to ask them anything. Let me know. And thanks for letting me ramble. It was really fun to talk about the program I love.
It's a great presentation. You got about 45 seconds left to answer some questions online. And then you could also take the questions that you're getting in the chat through the chat boxes as well.
One of the questions was asked about ballpark numbers for the major kind of procedures. Are you thinking about like knee injections, shoulder injections? EMGs, we're hitting like 200s before COVID. Knee injections, we're hitting hundreds as well. We're nowhere short of procedures. We do a lot of the MSK first year, PGY 2 years. So we actually hit all of the requirements for the most part within our first year. We're not short of that. And then mentoring in our program, Roy talked about the medical students that rotate as well. We work with a lot of medical students. They rotate, not only do they rotate, but we teach some of the courses. And then we have an email where a lot of the students will email us, and we're doing a lot of the outreach from that perspective.
Right. So unfortunately, you guys are out of time. But like I said,